Now, 63 more sites open across England today as the COVID-19 vaccination programme expands. However, there are concerns amongst GPs and health professionals about low take-up of the vaccine among black, Asian and minority ethnic people. Fake news is among one of the reasons being reported for the low take-up. Claire, you've been finding out more.
Yeah, this is a nightmare, actually. I've seen this story across the news quite a few days now, and the internet's wonderful for many reasons, but fake news can be such have such a bad influence. Dr. Harpreet Sood, who's leading an NHS anti-disinformation drive, said it's a big concern. Officials are working to correct so much fake news. He said language and cultural barriers played a part in the false information. And the Royal Society of Public Health recently commissioned a poll looking at the vaccine take-up. Christina Marriott is the CEO. Good morning, Christina.
Good morning.
So tell me, when you commissioned this poll, who did you look at and what sort of things were you asking?
So we looked at attitudes to the vaccination, and the great news was we found out that over 3/4 of the UK's population is keen to have the vaccine. And that's really good news because, of course, we need probably between 80 and 90% of the population to be vaccinated for it to work and for us to get out of lockdown. The more concerning news was that whereas 79% of white people were happy to have the vaccination, or were indicating they were happy to have it, amongst the black, Asian and minority ethnic groups, only 57% of people were saying that they were willing to have the vaccination. That's particularly worrying because we know that the black, Asian and minority ethnic communities, many of them have suffered most under COVID. They've had the highest rates of infections, and tragically they've had the highest likelihood of dying and the highest rates of dying. So it's in the communities that have been most badly hit by COVID that we're seeing a reluctance to take the vaccination. And our poll has been replicated by people like the ONS, the Office for National Statistics, and we're all seeing the same pattern, that there is an unwillingness to have the vaccination in some ethnic groups.
I noticed as well, GPs across the country have raised concerns over the false information about the vaccine.
Absolutely. So far we don't know if it is having an effect on people actually having the vaccination, but we do know there's a huge amount of disinformation out there. We are seeing lies just being targeted at some groups on religious grounds, on ethnic grounds, trying to discourage people from having vaccination. If it happens, if people are dissuaded from having it, those communities will continue to suffer from COVID. They will continue to see the infections. They will see long COVID. They will continue, tragically, to see the death that COVID causes. And we shouldn't forget that in the last 2 days, we've had nearly 3,500 deaths reported in the UK from COVID. This is very much an ongoing problem. We need to be taking personal responsibility for the information we share. Because, of course, people believe it. If it comes from their friends and they're seeing it time and time and time again, of course people start believing it because it's the information they're seeing. We know disinformation works.
I was curious about some of the reasons, and I don't want to make this sound worse, obviously, but I noticed that one of them, now, just before I say it, this is not true. There was concern over halal and alcohol from some Muslim communities. So this is the kind of extreme misinformation that's out there, isn't it?
And it's a blatant lie. There is no alcohol in any of the vaccines. And doesn't that show what people are trying to do? They are lying about what's in the vaccines to try and stop some people from taking the vaccination.
How can you get the right message out to these communities then? This is the big challenge.
So I think it's great to see the communities themselves responding. So the Mosque and Imam Advisory Board has come out and said that people should be taking the vaccinations, and they've encouraged conversations in Friday prayers. The Hindu Council has. We know a lot of communities where people are educating children to help educate the parents. We see lots of community work going on that's really strong. Good community leaders coming out supporting vaccinations. Loads of people modelling on Twitter, getting their vaccinations done. Loads of healthcare professionals from the Black, Asian and minority ethnic groups tweeting as they get their vaccinations done. This comes down to getting the right information out there in the communities, and the communities are responding really well to this. What we would say Be responsible about what you share. Make sure that you look at shareverified.com, which is from the UN, or covid19graphics.info, a fantastic website set up by a couple of NHS doctors who were concerned about what was happening in their own communities. So take responsibility for what you share. If you're not sure, talk to a healthcare professional. They won't mind. They are there to share the information. If you see something and you're not sure if it's right or not, and it's stopping you getting the vaccination, ask somebody, talk to your GP, talk to a nurse, ask a healthcare professional, and get the right information to make your decision about whether you're going to have the vaccination that could possibly save your life.
Thank you very much. That's Christina Marriott, CEO of the Royal Society of Public Health.